Welcome to the Digital Health Pulse. I'm Trevor Yasinow. Let's jump into today's conversation. Hi, everyone. Welcome to another episode of the Digital Health Pulse video series with myself, Trevor Yasinow. I am joined today by Mr. Digital Health, Danish Nagda, founder and CEO of Rezileint. Welcome, Danish.
Hey, thanks, Trevor.
Of course. So, Danish, just to reiterate for the viewers, the reason why I wanted to have you on and do this is that I wanted to create a very digestible, easy to watch video series that highlights innovative companies and leaders in the digital health space, providing a high level overview of what these companies do and how they differentiate themselves.
Yeah, happy to share what we do.
Perfect. So, with that being said, my first question for you is, can you tell me more about Rezileint?
Yeah. Resilient was born out of my experience of being both a doctor and a caregiver for my dad. The story of Resilient is sort of the story of my family. Dad comes to this country, works really, really hard. All three kids go to the best schools in the country. But despite having access to good health insurance, he didn't have good access to health care. He ended up having his first heart attack when he was 53. By 60, my father had heart failure. And by the age of 69, he passed away. And I actually became his caregiver while I was in residency at WashU. And that experience really formed the basis of what we do at Resilient, because my dad was also the top claimant on his health plan. And not only did he lose and our family lose, but his employer also lost a ton of money, and everybody was affected negatively except the system. So I said to myself, what do I want to do next? And we built Resilient. And the basic premise behind Resilient is that it's a new kind of health care delivery system where you get same-day access to primary care, specialty care, and let's say that our system can't handle everything, we also do care coordination downstream to the rest of the system. The basic premise behind this was, well, to do this effectively, you need to be able to scale. The issue with the current models when you do primary and specialty care is that they're very, very capital expenditure heavy. And so we wanted to make a capital light model, and the approach that we came up with are called cloud clinics. So virtual care when appropriate, in-person care when appropriate, but even when you go in person to one of our cloud clinics, the doctors are actually on the screen, and all the tools in a doctor's office are connected to Resilient and live streaming to the doctor. Not just for primary care, but even for specialists. So for a primary care doctor, maybe they're looking at your ear. For a dermatologist, they could even look at your skin. Let's say you have a mole in your forearm. We have a person in the room. They're a paramedic. They're called a presenter. They grab the dermatoscope. They put it on that lesion. They take the dermoscopy, and it's sent to one of our dermatologists. And in 4 hours, you have a diagnosis and a treatment plan. On average in the United States, it takes about 3 months to get in with a dermatologist. If God forbid you had skin cancer, that is an unacceptable amount of time to wait, right? And so we give same day access, not just to primary care, but also to specialists.
It's incredible. Thank you. And I guess you kind of alluded into this, but what makes Resilient so unique compared to others in the industry? We've seen so many different companies try this, but some have, failed, I would say.
Many have failed, and they should. Bad unit economics. And so, if you're going to build a business that is truly going to be transformative, you need a few things. You have to be obsessed with the consumer, the end patient. That's number one. That is a non-negotiable. So, across our entire book of business, Resilient's Net Promoter Score is 92. For context, WashU and Penn are less than 40, where I came from. So, not to hate on them, just keeping it real. Number two, when you look across our entire book of business, the second big thing in clinical model is quality outcomes. When you look across our entire book of business, Resilient is performing on HEDIS measures better than 90th percentile of all doctors in America. That means you're going to a physical clinic where the doctors are on the screen and they're better than 90th percentile of in-person doctors in America. And then number three, the thing that makes us probably the most unique is the same day access to primary and specialty care. Because one thing that we found when we did our analysis is that yes, primary care is great and super important. They quarterback care. Everybody believes in primary care. We should believe in primary care. But when you look at the employer market, the problem with primary care is that it actually doesn't bend the cost curve fast enough because it takes a long time to change behavior. And by the time the behaviors change, that's somebody else's employee. So with Resilient, not only can we help them get healthier by providing good quality outcomes, we can also bend the cost curve by reducing the health plan's reliance on specialty care. And so it's a win-win in that way.
It's amazing. So with Resilient, who are your primary customers and how do they benefit from the solution exactly?
So we work primarily with employers, and the model is that we come in, we understand their costs, we evaluate it as a value-based care provider, and we come up with a value-based care framework for them. It's usually a PMPM, and we work closely with them then to understand how their health plan is designed. If they have different vendors that they work with, other providers that they work with, what does their network look like? And then we actually put it in to our systems, and even, their formulary from their pharmacy, we put it into our systems. So every touch point the patient has with Resilient, we know exactly how the health plan is designed. You can't be a good quarterback without knowing the plays. And so we need to know the plays of the health plan. And we work primarily with employer self-funded health plans.
Makes total sense. So taking a macro view of digital health currently, just would like to know from your side, what is one exciting trend that you're seeing in digital health right now?
I think we're seeing a lot of the riffraff go away. That's pretty exciting.
Yeah.
I think we're seeing, if I'm out there looking for opportunities as somebody who's interested in digital health, I would say really do a good job of diligencing the company. If they're not sharing their outcomes. So now, for example, Trevor, in terms of trends, expectations are high again. For a little bit, 2021, anybody could put up an app and try to sell it, right? But employers are asking more thoughtful questions. I think brokers and consultants have gotten much better about vetting solutions. And so the biggest trend we're seeing is expectations of actual data have gone up significantly. I think a second trend is that point solution fatigue is out of control. So you could have point solutions for every single bone in your body at this point. I mean, we have a customer, they have 20 different digital health apps. And that's no user is going to use all 20. So engagement is absolutely awful. So we're seeing this new move over integration, rebundling. That's kind of why we exist, is because when you get Resilient, you don't need a lot of those. And so we consider ourselves one of the core solutions to get rid of point solution fragmentation and point solution fatigue. And I think point solution fatigue, you're going to hear about it more and more and more. And it's going to be used as the reason why a lot of the digital health companies are going to suffer in the next 12 to 18 months. But it's also good because the ones that sustain are going to be the ones that will really take off.
Absolutely. Super helpful. And what does the next year look like for Resilient? Any big goals or milestones on the horizon?
Well, this last year was quite wild. I mean, we
That's an
we raised our
understatement.
Series A. Yeah, we raised our Series A. We've been growing 600% year over year. We've now built out our sales team. We are excited about kind of this growth period. So there are a few things that we're going to be doing. One is growing our book of business, so hyper focus on growth, expanding into multiple new states in terms of our cloud clinic footprint. But also we're expanding across indications. So we have same-day access to primary care specialty consults across 70 specialties, but also we're now going to be launching our own MSK solution. We're going to be launching our own medical weight loss solution. We're going to be launching our own women's health solution. We're going to be launching our own GI solution. We're going to be launching our own mental health solution. Same app, one integration, no more downloading 50 different apps, one solution for the entire.
It's incredible. That is exciting, and I'm excited to see it. So just want to say again, Danish, it was great to learn more about what Resilient is doing in the digital health space today. I'm looking forward to seeing all the exciting things that the company, yourself will be doing. Just thank you so much and really appreciate your time.
Thanks, Trevor.
That's a wrap for this episode of the Digital Health Pulse. A huge thank you to my guest today. If you enjoyed this conversation, be sure to like, repost, share, and follow for more chats with the top innovators and leaders in digital health. Have a company you'd love to see featured? Drop a comment or reach out. Thanks for watching, and I'll see you in the next episode.